Ladies and gentlemen, our next session, we are done with our panel discussions and now we move on to some independent presentations and live demos. While our doctors are busy with the camera, I will introduce you all to the next session. So our next session is powered by InMode. So our next session is powered by InMode. The session will focus on two segments: paradigm shift in laser hair reduction and next-gen facial sculpting and beyond. The session is going to be presented by Dr. Geetanjali Shetty. A few words about her before she joins us and giving my team some time to get this setup done. Dr. Geetanjali Shetty, consultant dermatologist and cosmetologist, is the director at Revitalis Skin Clinic, Mumbai. She has a fellowship in cosmetic dermatology from the Academy of International Medicine, USA, and is trained in dermatologic laser surgery from Barcelona and Boston University of Medicine. She is an expert trainer and speaker at many national and international conferences and a reviewer of many journals. She is a key opinion leader and leads a team of passionate scientists researching technologically advanced ingredients for next-generation skincare. So we'll give us like roughly 5 minutes and we'll have this whole setup arranged for you.
Hi, a very good afternoon from me to all of you all. I feel happy to be here. Firstly, to be an invited speaker as part of this session. Secondly, I'm also meeting my friends after a long time. I think this is after a long time that I'm meeting in person. This brings me back to this pandemic era story that I was in. And I think I was privileged enough to buy this as the first buyer all over India. And I was just going through the talk yesterday and I realized they have 130 installations already. So I think I trusted you all a lot, and I'm sure we have a long way and the result seems to be impressive. Another thing that brings me here is, I think from wherever and whichever part of era that we are, hair has always bothered us. And yes, the retrograde hair or the paradoxical hair growth, burns, pricing, repeated sessions, all that we saw about the pandemic and how we are handling. This particular platform that I bought has many probes. I'll be today sharing 3 of them and my experience of how it has been throughout the last 2 years. So I'm starting my first session, which is about the laser hair reduction. And I'm going to call my session as a paradigm shift. The shift because it really speaks a lot about all the technologies that is there in the machine. And of course, my experience. We all know about the electromagnetic spectrum. I've kept it very short. We all know about the pulse width, the pulse duration. What's more important? We need a coolant. The side effects that happens, affluent energies, proper fluence, good amount of energy. We all know what's the pulse width. We all know how cooling plays a very important role. We all know when it comes on to Indian skin, we are usually type 2, type 3, type 4, and more so also type 5 once we go down to the south side. And we also know the chances of the burns that increases with these type of skin. I think the major hindrance comes when the patient comes back after 2-3 sessions and says, okay, my leg hairs is all good, my underarms is doing fantastically well, but what about these fine, fluent hair, lightly pigmented? Doctor, how are you going to take care? Now, my experience talks about usually having a single standalone, probably, a 20-25 lakhs machine, which caters to probably one type of hair, and then we keep playing with the fluence or the pulse width, or probably try doing sessions, small gaps, repeated sessions, more than 12. End of the day, one room, one laser, one girl, one technician, 12 to 13 sessions, time consuming. It all involves from shaving to cleaning the patient, applying the gel, removing the gel, cleaning the particular place, the doom, the smell, the hair that stays behind. So what are we talking at the present generation post-pandemic? Something that's faster, something that's quicker, something that has lesser side effect. I introduced to you a special technology which does not have one wavelength, but it has 2. And mind you, the opportunity of these wavelengths extend from all 3 wavelengths. They have a blend of an alexandrite and a diode, which usually in India we are not in so much of favor of. Whereas the one that I'm using is a blend of a diode as well as the 1064 or the long pulse NDAC that we are looking at. Why am I so happy with these specifications? I have a mixture of crowd. I practice in Mumbai. Not only I look at small, fine hair on the upper lip probably or on the hair, lightly melanin content, but I'm also looking at an hirsutism. This took care of all my patients all across. Pain was amazingly less in this particular. The most important thing what I loved about this was the fastest technology that I ever came across. This has 3 wavelength specification. We all know about alexandrite and how it cannot be used in a darker skin. Diode, which is, I think, the technology that we've all been using a lot. Long pulse NDI, yes, works fantastically well in a high melanin index of hair. The Triton family or the InMode as a family has 2 wavelengths and 2 particular various headpieces. One which they call it as light, which is a mixture of alexandrite. What I have is the dark. It's a mixture of 810 and 1064 blend. It's very effective for all skin types. So far, I am happy to say that I have never come across any side effects till now with my machine. Honestly, my girls use it freely and fairly. We take around 6 to 7 full body removal on a day. I'm very happy with the way it is fastest. The most important thing here I would highlight is we've seen so many triple wavelengths and double wavelengths that are there in the market. Mind you, this is one of the only machine that has an FDA clearance for firing 2 wavelengths in a single pulse. So I would just put on a small line. The machine has its own brain. Fine hair, thick hair, highly pigmented, less pigmented, villous, telogen faced. The machine handles it well. It knows what to fire when, at what area and at what level. Coming on to the fusion technology, as I said, it's as a mixture of a diode as well as an Nd:YAG. Coming on to the spot size, I'm sure there are so many of us clinicians here and we have a spot size of 1.5, max 2. I have an Nd:YAG which is 2 centimeters square. Now this particular thing has a spot size of 3. So imagine how many spots on the face, 15, 20 and you're done. The patient goes back away. Coming on to the competitors, they do have a higher spot size, but then there's always a choice of a higher spot size and a lower fluence or a higher fluence and a smaller spot size when it comes on to getting the results. This spot size promotes a faster treatment of the selected area. Will you be surprised if I say it's just 12 minutes for both the half legs and around 15 minutes for both the full legs? Also, it delivers without compromising the fluence and without compromising the efficacy, and the safety is intact. Additionally, what I like about it is its amazing cooling technology. It's got this nice sapphire plate which has 3 modalities. One, it has a strongly frozen pre-cooling plate which takes its light around to 4 to 6 degrees, a parallel cooling at the sapphire tip and a post-cooling tip. Summing my session, I've kept it very short. We have an hands-on and we're taking questions then. One workstation with simultaneous blend of energies. Fastest, the spot size of an amazing 3 centimeters square. Impressive fluence right from 5 to 40. A pulse duration which can go as short as 30 to as long as 80. A good repetition rate of 1, 2 and also 5. I have my stamping mode for my face and smaller areas and my glide mode. So summing up, one session, 45 minutes. How many patients in a day? Maybe 10 to 12. Lastly, how many sessions do you think a patient needs for a hair removal? Any guesses? How many sessions do you all do in your clinic for a hair removal? 6 to 8. How many? Okay, 8. How many, Rixin? Tera 8 hai. So till now I've done 6. I've called my patients for a maintenance 1 in 6 months. So maybe next time I'll be in a better version to post. For now I have 110 full body going on in the clinic. So I think I'll have enough data to publish soon. Okay. I'm just presenting a short video here. Both the blends. The amazing thing is it's blast, it's all the levels, taking care of all your follicles. Amplitude of the energy is the same throughout. There's no fluctuation in the energy that happens. You need to have a nice contact touch point. So your fine villous hair as well as your dark, dense hair at different levels, both are taken care of simultaneously at the same session because the probe fires both the wavelengths at the same time. I'll move on ahead. Coming on to the advantages, as I mentioned, the coolest 4 to 6 degrees, minimum sessions, as I said, 4 to 6. However, I go till the 6. I do one every month or month and a half initially, and then once every 2 months. Number of shots, maximum 6,000. I've counted it and taken care of it. Hence, highly cost effective. And there'll be more talking about is when we do on the hands-on. A last video and post that we go on to the hands-on wherein I'll be taking your questions and Mr. Vadera, the head of InMode, will be taking us through the hands-on.
Hello. This is what you will see, the fusion technology. We don't call it a double wavelength. This is like 755 and 810 have been fused, and this is the only US FDA approved fusion technology wavelength. Now it is something like, in a simple language, if we say, then we say that we are shifting from manual gearing cars to automated gearing cars. Now when you are moving the handpiece over any body area, the machine, the handpiece will automatically sense what is the percentage of coarse hair and fine hair. So suppose you are giving 100 energy. So if there are 60% coarse hair and 40% fine hair, then it will divert its energy 60% towards 810 and 40% towards 755. So that's something, this is an advanced technology. That's why we call it next gen, and that's why the number of sessions have been reduced. Because from day one, you are treating all type of hairs at one time rather than using different handpieces. And you use the pulse technology, so you are not giving the multiple passes. So you are giving only 2 passes when you are gliding. And then you have 3 different modes, 1 PPS, 2 PPS and 5 PPS. So 1 when you are doing the stamping, 2 PPS you have both stamping and gliding, so you can choose. 5 PPS is where you, when the therapists are, they are professionals and they are very proficient while moving the handpiece, they can always use 5 PPS. So what we are showing is fine hair only. In any case, no coarse hair, you may see like most of the machines work. So one hand she has got here, so second hand we have shaved only. And you will see how fast it is. Anybody, I'm sorry to ask at this time, and I'm saying if anybody wants to have a feel, so usually when people talk about, they talk about the temperature while it is in stationary phase. So they say the machine is -2, -5 or 0 or whatever. Actual temperature which matters is while you are lasing. So if you are lasing, the temperature is 4 to 6 degrees. The patient would be absolutely comfortable, and that's what this machine achieves. So this is one. Now this area is done. That's it. So the second one is done. So that's how you do it. You may make a grid and then you do it. You will find the arm getting done in 6 to 8 minutes only.
So along with the stamping mode, there's also a glide mode, which is much faster, especially for your male patients who find it very painful. You can just go on gliding and the entire bag finishes in 10 minutes.
Practically, because usually the LHR is done by the therapist only. So giving them a machine where they have to, every time they have to feed the different long pulse, short pulse or pulse width. So this gets rid of it because in Indian skin, you just keep long pulse, that's it. And there is a range and machine will pick on its own. So you need not shift the pulse width at all. So machine will automatically sense and will do it, that's it. So only thing is fluence, that's what you have to change. Rest everything is pre-fed.
So now what he's trying to show is the continuous mode.
This is 5 PPS. Done, that's it. And 5 you give 1 pass, done. Because you are giving 3 into 5 into 9. So 135 joules. A small brief about InMode. This was a company which was established 14 years back. This is world's #1 aesthetic device company now. We'll be touching 400 million this year. And we're listed on NASDAQ, US Stock Exchange, and has been among top 5 buying options across the year for 2021. Growing at a pace more than 60% year by year.
Okay, I have few pre and post. I think I'll end up with few of my pre and post. So this is after 3 sessions. So I've done a stamping mode on the face. Of course, we've taken care of her hormonal profile. This is after 2 sessions. After 3. 3 again, the same patient. 3 again. These are not my pictures, but they claim it's around 6 months later of the hair session done after 5 treatments. That brings me to the end of the diolace hair removal. Any questions? Samir.
Can you just explain that again? So you said that depending on the thickness of the hair, does the machine itself,
Yes.
the machine decides
Yes.
which wavelength to
It
fire?
is, as I said,
or
sir.
the percentage?
Yeah.
So
So
how
the
exactly
percentage
does it
would be
process?
decided by the melanin content only.
Okay, so
So
there's
the
a
machine
sensor in
sends that and then delivers that wavelength only to those hair only. So that's a beauty about this technology. That's why we call it fusion. So we don't say 755 and 810 bars are different. So there is each bar will have 755 and 810 fused into it.
And as the device, as the probe glides through the skin, it will automatically adjust it based on how the melanin.
Yes, yes. That's why the number of sessions are less. Because you are treating all type of hairs at one time. With the same pass. So you saw 5 BPS is like, even if you want to be very fast, no, you want to do it's like 5 BPS, somebody is that proficient, 1 pass, fast, done. That's it. So it is, I'm not saying this is a newer technology, next gen technology. And of course, you may find down the line 2-3 years, maybe others also coming in and then copying it. So we have been going through the other technologies which were there, which are effective by their time only. So probably the next time has come and this is the next gen, which is pretty fast and pretty effective. And regarding the hair reduction or the number of sessions, we are openly challenging it now. Reason being, we have seen it now over years now. We openly challenge that this is the fastest and the most effective LHR machine in the world now.
So Rix and I have a small experiment to share. So this is what they told me when they first bought the machine. And of course, we did a patch test and we found out perifollicular erythema. And so thigh is one funny area wherein the outer thigh has this thick, nice, densely melanin contented hair. and the inner thigh gets very thinned out. And the patient will usually land up saying, okay, this is good, but I have these fine hair on my upper lip, or I have hair now on the inner side of my thigh. But then when you power at the same joule and the same centimeter square the energy, the perifollicular erythema was there on all the hair types. So one step of believing in, okay, it does work. The second one was, of course, I have a canister inbuilt hair removal device also. It just does not hurt. So the first and the second session brings it down so much, but by the third session, the pain is absolutely minimal. And person who's doing this is now wanting to do it because it's fast. And I think you know the hurdle for shaving the patient, and then you plaster the extra hair, and then you change the mat, then you again make the patient lie, and then gel each part, and then you again do it. So what I used to do with my initial diode, I used to apply the gel half back, do it again and again and again. I would add another point. It's very light. I think you should just pick up, people who are interested in buying the machine should just lift up and see. Your technician is not going to come and tell you, oh, I'm tired doing an entire body. I love it for my male patients. It's not painful, even in the thickest of the hair that they have, which is one of the biggest hurdle I think we've come across. It does pain. How much ever your machine is good, the other modalities do pain. Trust me, this machine does not pain. How much ever thicker chest, beard shaving, it's fantastic. Now coming on to your bikini area. So again, I had a hurdle about the bikini area and the pain that I was delivering. Very comfortable. The stamping mode does 2 pps per second, does a fantastic job. So on and whole, I've been using it. Let me see what the future gets better in this company then. Okay. This brings me down to the next topic of today's session. So my ideology about picking up was the machine was first, I was looking at a micro needling machine, and I found all the micro needling machines had some pros and some cons. And as we mentioned, we are in Mumbai with a limited space. I wasn't ready to buy just a machine for acne scar. I already have a CO2 by the way. So I was just thinking what next. So of course RF, we all know, anti-aging, we're looking at contouring. I've now picked up a HIFO as well. But I took a demo of Forma on myself, and trust me, the results were remarkable. I mean, my dermats who are going to buy the machine, take a demo of the Forma first. And the Morpheus. The combination of the Forma and Morpheus will actually be another paradigm change in the field of anti-aging. So then I bought another 2 probes. I bought the Forma and then I bought the Morpheus. This brings on to the Morpheus for the body also, the stretch marks. That tempted me more in the lockdown, and I bought the Forma Plus for the body, looking at Rixin and Rixin's post. That pushed me for my double chin patients. Now there are these patients who have a lot of blob of fat, and I was still not sure to venture into body contouring. Again, the place, limited girls, do you want to really venture? I have another probe which I'm not talking today, it's called the Mini FX. So that kind of made an entire museum of the machine with me, and I have all the probes handy. I'm not investing a lot of place. It's a standalone beautiful machine. It's very handy, very light. Now the beauty about all these probes is you'll realize people who have the other RF machines, it's like a small pen. So your teeny mini girls and your aestheticians who are sitting the entire day, and you know how tedious it is to move on, 10 minutes, 10 minutes, 10 minutes, 10 minutes, attaining the temperature, checking the temperature, worried about the burn. You'll realize how easy peasy the game gets as we are getting and venturing. I mean, even as dermatologist today on this platform, it's not only about this machine, but when I'll end up seeing 100 patients a day and I'm doing around a 30 procedure, I'm also wondering about my girls who are tired throughout the day. I think as physicians, we also need to cater to their trapezius muscles and their deltoids and their hands and how tired they get once they reach home. I loved this machine for various reasons. Safety profile of the patient, yes. I also found it very safe, less tedious for the girls who were operating it. They were pretty happy once the machine came. We stopped doing the RF machine that I had before. So coming on to the next generation facial sculpting, I'll be talking about the Forma. Now Forma has 2 probes. It has a Forma and a Forma Plus for the body, which has the biggest size of the probe. And post that, I'll be talking to you about the micro needling, or they call it, this is not micro needling, it's the next generation, next device. So the Morpheus. I think it sounds like a gangster. Starting with the Formeus. The Forma particularly is an RF, and I think all of us know what a radio frequency does and at what level it penetrates and how it modulates. Now this particular device talks about something which is called as an autothermal contact, or the ACE technology for immediate lifting and tightening. Now, the automatic thermal skin tightening device has temperature which monitors automatically again here, and it also has this amazing brain to cut off once the contact is lost. They call it as a non-invasive skin lifting and tightening. They have some fantastic pre and post results. They are pain-free. There's absolutely no downtime. Patient going immediately attend a function. There's no redness, no edema, nothing. No chances of burn at any point of time, even if the esthetician is not trained. There's a constant temperature reading that is shown on the screen. The probe makes it a point that it cuts off the energy immediately once you lift it. The heat distribution is evenly, and mind you, it's evenly, and they have papers published to prove this. So what exactly is an ACE technology? They call it acquire, control, and extend. Acquire, to reach the temperature, hence prolong heating at the desired temperature between 38 to 43. Control, controlling the temperature throughout with a nice cutoff, and extending the temperature for the extended period of time all across. Hence safe, there's a uniform distribution of heat, no tissue at any point of time is overheated. Our therapeutic optimal temperature, mind you, this particular line is very important because only then it modulates the collagen rightly, and hence the targeted heat is reached to the treatment area wherever it's desired. A short animation video. The beauty about this RF is the energy is through and through in a circular pattern. Hence the thermal coagulation time is also even, and the thermal energy that is received by the tissue throughout the session is even. So the penetration of the rays is equal throughout. I think I'll just keep on with the same because my photos aren't visible. So I think we'll go without that light. Coming on to the ACE technology, it has this nice sensor. I said there's an optimal non-ablative heating temperature in the dermis. So the beauty about this particular procedure is not only is the texture improved, but the new collagen, the new elastin, and the soft tissue modeling is also taken care of. A 5 millimeter penetration depth that's even, that's taken care of. A maintained temperature of 40 to 43 is done with this constant movement. Hence, immediate skin tightening, long-term tightening by collagen remodeling, and a smooth de-junction. Various papers to prove wherein there have been substantial differentiation in the dermal collagen content. There are also histological sites that prove around 60% of collagen has been stimulated every session of the treatment. Few results of Forma. These are not my patients. I also feel, I was just speaking, the challenge about taking the Forma is I think the lighting needs to be all right. Few results of the Forma Plus around 4 or 5 treatments later. Few results of combination treatments. These are my patients. I've done around 3 sessions of Forma and Morpheus. Around 2 sessions of Forma, around 3 sessions of Morpheus in this patient. Look at the nasolabial. We just spoke about the filler session before. You see the glistening and the sharpening of the angle of the mandible. There's a nice contouring that's happened here. This is after 3 sessions. This is after 3 sessions again. Coming on to the Morpheus or the microneedling that I spoke about. Now the Morpheus comes with around 4 different type of needles. They call it as SAD, which is a minimal invasive subepidermal or subdermal adipose remodeling device, which is specifically designed for dermal treatments and epidermal resurfacing. It's got this amazing gap of around, you can start it off from 0.5 mm to 7 mm. What it does, it does 3 actions at the deeper level, which is fat coagulation, connective tissue contraction, and subnecrotic bulk heating. Along with that, there's also a tissue ablation collagen remodeling that happens. Mind you, at around 5 to 6 millimeters, it also does a subepidermal adipose tissue remodeling. Again, safe on all skin types. So this is how it works. Initially, there's a small ablation that happens through the needle. Every needle is a titanium make. The beauty about this is the energy is delivered only at the tip of the needle. Hence, no soft tissue ablation, pretty safe. Nothing to be seen on the level of the epidermis, no downtime. 24 hours is the downtime, and by next day, the patient is all good to go back. Large contraction zone, large volume of tissue are simultaneously heated together. So this is how it is delivered at the tip wherein it gets ablated. Then a procedure of coagulation followed by a non-specific heating of the collagen happens. In the next picture, what I've shown is how it happens throughout and at the tip, and the temperature is maintained throughout. Very quickly, differentiations, bipolar RF, every needle has an electrode, low density of needles, thus reduced mechanical damage, high penetration depth, and the depth of penetration is at the tip. Hence, strong bulk heating, vice versa, there's absolutely no bulk heating that happens with other devices. The energy is 5 times more high. Single treatment gives you amazing results. So we've been using it all over, body stretch marks, facial acne scars, fine lines periorbital. They have a special rope for under eye and also for skin resurfacing. So the Morpheus 8 resurfacing, the difference is the needle size. The first one you can alter right from 1 to 4. So what we do in a particular phase is now we have box scar, ice pick scars. So we go on right from 4, then we come at around 3, then we come at around 2, and then we come at around 1 for the superficial open pores that we have. Under eye, of course, we go as to a depth of 1 mm. They have a finer 12 needle that comes for the under eye area. The advanced latex design gives you an uniform effect. They have a probe, so it's a handheld device, very light, very easy to use. This is specially designed for your face, your neck areas, your cheeks. If you have a thicker jowl, then they have a body probe that can be used there. The resurfacing is just for resurfacing. They have a 0.5 mm of needle all throughout. The Morpheus Prime, again, has 12 coats. And as I said, these are for finer areas, bony curves like your forehead, your smaller areas of nose, or the tip of the nose, sometimes where you have these open pores. And finally, the body needle, which goes to a depth of, mind you, 7 mm. There are very few machines which go till that depth. One of my other reasons for picking up. Nice 40 thin gold-coated micro pins. And again, the sessions are faster. Comparing all the 4, the first one is the resurfacing, I told you 0.5, and the last one being the body goes right up to 7 to 8 mm. There's something which is called as the burst technology that happens in the Morpheus body tip. And how does that work? There's something called as a vulcanization, wherein there's a charge, mold and weave that happens, wherein the energy is delivered right across the dermal level. Not only it kind of creates the collagen, but it also causes a weave effect. So that's something called as a vulcanization of rubber, wherein each strand of rubber is strengthened by that process. So here, each collagen modeling happens at every level. That's about the burst technology I spoke about. So different levels is where you can use. Same session you can hit at different levels. So I think especially in acne scars, there are different level of scars. So there are deep scars, ice pick scars, superficial scars, open pores. You can go as superficial in resurfacing to around 0.5 mm. Coming on to few of my results. This particular patient is actually an actress who met with a car accident, and she did not want to do anything like a CO2 because she was scared. So I've done around 3 sessions, and I'm still doing more sessions. This is the last 6 months result. I don't know whether you can appreciate. If that light goes down, I think the results will be much better. I think better, right? The color completely changes there. I mean, this is one patient of mine who I was personally very impressed. This was one of my start, wherein I've done few other modalities, but this one was just starstruck. I mean, she still comes to me, so happy. She's gone so many other treatments from me. I've just done 2 sessions with him. So there are other modalities also wherein active acne can be taken care of, and this again is one of my to-go indications. So these are my before and after, and trust me, this is just 1 session. These are 2. This is same patient. This is just 2. Again 2. 3. 2. So not only am I using it in my acne scars, it can also be used on your body stretch marks. Cellulite also gives you good results because, mind you, you're going to a level of 7 to 8 mm. Last and not the least, the beauty. Google InMode, Google Morpheus, Google Forma. It's taken care of. Kim Kardashian is there for you to advertise the machine. Every social media guy is talking about this machine. They've taken really pains to, make awareness about what a Forma is or what a Morpheus is. So, lot of awards, lot of back support. They have an online site wherein you can pick up all the research papers. Social media designs are also available. It gets that easy. There are a lot of brand ambassadors. It's there on all the TV. It's also there on Netflix, by the way. So amazing support from the company, from the social media influencers.
Right now on my stomach.
That's your favorite, Kim. I think we called her 5 times on the dais today. So this is all to sum up for today afternoon, and I think we'll have a live demo on Morpheus quickly if you have time. And that's about it. A very warm thank you to all of you. Thank you for having me, Shriyal. Thank you. Thank you.
Do not compare Morpheus with any other MNRF. The reason being, this we call it fractional RF. This is again a next generation technology, where you will find a pair of electrode behind each needle, usually for the entire consumable what you have. You either find a 2 pair of electrode or maximum 4. Here you find 24 pairs in 24 needle and 40 pairs in 40 needle. That's why the results have been so powerful when you see this. This is the only fractional RF in the world where you will feel a stretch mark जब आप treat करते हैं. So then you choose if 7, 5 and 3 on the screen. So one puncture will go in and will fire at 7, 5 and 3 in one go only when it comes out. Now second, whenever it fires, it has got a 1 mm thermal penetration as well. You choose 753, you actually end up treating 2, 4, 5, 6, 7. So that's where the results with Morpheus are extraordinary. And as I say with LHR, now we say with Morpheus or Forma as well, it is an open challenge to any technology available, and you will see a sea difference while you have it on before one half with this technologies and one half with any other technology. So that's a game changer actually Morpheus has proven to be.
She started doing the session. So I just wanted you all to just see the probe. The probe is very light, and the moment she kind of loses contact, there's an alarming beep that the particular probe shows up. So pretty safe, temperature is thoroughly maintained. It's a gliding movement. Look at the probe, very light, very easy, very comfortable.
Therapists do not have to see at the machine. They have to just hear the sound. So now you see a 1 sound, then there will be a 2 sound. The moment there is a 3 sound means you have reached the temperature and machine will automatically cut the RF supply. So by any means, no, there cannot be a burn with Forma. So that's why we all call it that these all technologies are grade 1 US FDA approved technologies. So, and second important thing is usually when you give it to therapists, because docs don't do it, it's a procedure which takes around 30 minutes. Now the machine will tell you the actual time, will not be a clock time. So no therapist can come and say, "Ma'am, मैंने आधा घंटा मैंने तो कर दिया," but then you see patient will come and say कि result नहीं आया. Because machine will tell you कि आपने exact किया कितना है. Suppose 30 minutes clock time है लेकिन proper नहीं किया हुआ है. So then you will see on machine it may appear like 10 minutes, 12 minutes or 15 minutes only. If somebody has done properly, 30 minutes clock time है तो 24 minutes actual time आ ही जाएगा इसमें. So that is an actual time when you are delivering the energy and the machine is actually working to boost the collagen. This is only RF in the world which reaches 5.2 mm and anybody can do a thermal scanning as well. Thermal scanning will prove that how deep does it go. No RF goes 5.2 mm. Only thing is this is a lunch time, otherwise no, doing 10 minutes on one side. No, you may appreciate the result after 10 minutes on one half. If we're doing one half and other half, no, you can really see it after 10 minutes. Now the Morpheus would be shown. The Prilox we have applied around 40 minutes back, 45 minutes, roughly 45 minutes. One pin lasts for multiple sittings. There are no short cap that after 1200 or 1500, no, usually needles get blunt. Here we have gone up to even 6000 shots and needle still goes. So if you have to do 4 sittings, suppose there is a bad no scars or the skin tightening, even one tip is good enough for all 4 and maybe later on for a top-up session as well. Usually when people...
This tip has 24 pins. You also get a 12-pin tip for the under eye. And you have a depth right from 1 to 4 mm that can be taken care of. So it's very light. You have a different mode. You have a fixed mode and you have a cyclical mode. So that's how easy it gets. We're doing a depth of 3 mm now. So what I practice is basically I do an entire face with 3 mm and then I do an entire face doing the grids overlapping it by 2 mm and then eventually 1 mm everywhere like a resurfacing treatment.
This talks about the thin needle and the needle quality. You don't see really a bleeding treatment area. No, yet you will see the edema and then later on you will see the results as well.
Sorry? 4 to 6 weeks, but you can also do it once in 3 weeks because the downtime of this particular procedure is very less. By 3 days, the pinpoint bleeding or the pinpoint scabs that are there, they completely clear off. So it's a weekend procedure. So I think that's it from our side, at least from my side for today afternoon. Thank you for being a wonderful guest here. Thank you so much.
Thank you so much, Dr. Geetanjali. And we would now break for lunch, but before that, I would like to thank Dr. Geetanjali with a token of gratitude.